Phlebotomy practice questions and answers. Question 1. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A. It decreases the pain perception of the infant. Option B. It increases localized arterial blood flow up to 7-fold. Option C. It sterilizes the deeper layers of the epidermis. Option D. It prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 2. What color top tube is used to collect specimens for lead testing? Option A. Tan or royal blue with EDTA. Option B. Light blue. Option C. Light green. Option D. Yellow. The correct answer is option A. Tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 3. What type of patient environment requires protective, reverse, isolation protocols? Option A. A patient with an active, contagious respiratory flu virus. Option B. A patient with an open, draining MRSA wound infection. Option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D. A patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 4. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A. Cyanosis. Option B. Jaundice, icterus. Option C. Erythema. Option D. Pallor. The correct answer is option B. Jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 5. Which of the following elements is a primary link in the chain of infection? Option A. The source or reservoir of the pathogen. Option B. The cost of personal protective equipment. Option C. The layout of the outpatient laboratory facility. Option D. The brand of antiseptic wipes used to clean benches. The correct answer is option A. The source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 6. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A. Prothrombin time, patient. Option B. Erythrocyte sedimentation rate, ESR. Option C. Basic metabolic panel, BMP. Option D. Blood culture series. The correct answer is option B. Erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 7. How should a phlebotomist approach a child who needs a blood test? Option A. Tell them it will not hurt at all to gain their trust. Option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C. Have 3 guards hold them down before introducing yourself. Option D, show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 8. What is the primary purpose of the laboratory's safety data sheets, SDS? Option A, to track the daily attendance and performance records of employees. Option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Option C, to schedule the preventative maintenance routines for centrifuge machines. Option D, to log the critical panic values reported to physicians. The correct answer is option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 9. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, radial vein. The correct answer is option B, basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 10. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 11. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 12. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option A, light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 13. What does the term basal state refer to in clinical laboratory testing? Option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B, the physical state of the body directly following a heavy workout session. Option C, the point of highest metabolic activity in the afternoon. Option D, the body state while under heavy psychological stress. The correct answer is option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 14. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B. Chill the tube in an ice slurry immediately after drawing. Option C. Protect the specimen from light by wrapping it in heavy foil. Option D. Centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 15. Which of the following is an example of an analytical component of quality assurance? Option A. Double-checking patient identity wristbands. Option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Option C. Delivering critical panic results to a physician on time. Option D. Labeling the collection tubes at the bedside. The correct answer is option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 16. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A. SST, light blue, blood culture. Option B. Blood culture, light blue, SST. Option C. Light blue, SST, blood culture. Option D. Blood culture, SST, light blue. The correct answer is option B. Blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 17. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A. Check the site to confirm that active bleeding has completely stopped. Option B. Ask the patient to bend their elbow firmly over the gauze pad. Option C. Apply a generous layer of antibiotic ointment to the wound. Option D. Label the tubes using the patient's bedside charts. The correct answer is option A. Check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 18. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A. Press down hard on the needle to flatten out the swelling. Option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C. Switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D. Continue the draw until all ordered tubes are filled completely. The correct answer is option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 19. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A. Orange top. Option B. Light blue top. Option C. Lavender top. Option D. Gray top. The correct answer is option A. Orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 20. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A. It is too small to yield an adequate sample. Option B. It is located near the brachial artery and median nerve. Option C. It has a high tendency to collapse under low pressure. Option D. It contains valves that prevent blood flow into the tube. The correct answer is option B. It is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 21. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A. Dropping a needle into the sharps box immediately after withdrawal. Option B. Pushing down on items inside a full sharps container to make extra room. Option C. Disposing of a sharps box when it reaches the indicated full fill line. Option D. Placing the sharps container at eye level near the point of use. The correct answer is option B. Pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 22. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B. Releasing the tourniquet as soon as the first tube begins to fill with blood. Option C. Utilizing a needle with a large lumen, such as a 21-gauge needle. Option D. Having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 23. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A. Cryoglobulins. Option B. Ammonia. Option C. Lactic acid. Option D. Free fatty acids. The correct answer is option A. Cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 24. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A. Convince the patient by explaining the doctor's orders. Option B. Proceed with the draw while the nurse holds the patient's arm. Option C. Document the refusal and immediately notify the nursing staff or provider. Option D. Leave the room and mark the collection as completed. The correct answer is option C. Document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 25. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A. Patient's first name, last name, and unique medical record number. Option B. Patient's room number and name of their primary insurance carrier. Option C. Name of the ordering physician and the date the patient was admitted. Option D. Patient's diagnosis code and home phone number. The correct answer is option A. Patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 26. Which of the following scenarios describes the correct patient preparation for an oral glucose tolerance test, OGTT? Option A. The patient should eat a low-carbohydrate diet for 3 days prior to the test. Option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. Option C. The patient should exercise vigorously right before drinking the glucose solution. Option D. The patient can drink black coffee or tea during the hours of the testing period. The correct answer is option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. An OGTT begins with a fasting baseline specimen, usually after 8 to 12 hours without caloric intake. Food, coffee, or strenuous exercise can alter glucose metabolism and invalidate the test. A low-carbohydrate diet before testing can also distort the response to the glucose load. Question 27. Which of the following tests requires a 24-hour urine collection? Option A. Culture and sensitivity, C and S. Option B. Creatinine clearance. Option C. Routine chemical urinalysis. Option D. Pregnancy HCG confirmation. The correct answer is option B. Creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 28. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A. Light green top, PSD. Option B. Gold or red / black marbled top, SST. Option C. Lavender top, EDTA. Option D. Light blue top, sodium citrate. The correct answer is option B. Gold or red / black marbled top, SST. Gold or red-black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 29. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act, HIPAA? Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 30. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A. 30 minutes. Option B. 2 hours. Option C. 4 hours. Option D. 8 hours. The correct answer is option B. 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 31. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A. Over-isotonic chilling. Option B. Exposure to direct room light or sunlight. Option C. Inverting the tube more than 10 times. Option D. Delays in serum separation beyond 4 hours. The correct answer is option B. Exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 32. A phlebotomist must collect a cold agglutinin sample. How must this specimen be transported to the lab? Option A, chilled on a slurry of ice and water. Option B, maintained at body temperature, 37 degrees Celsius. Option C, protected entirely from light exposure. Option D, frozen immediately in dry ice. The correct answer is option B, maintained at body temperature, 37 degrees Celsius. Cold agglutinin specimens must be kept warm because the antibodies can react at lower temperatures and alter the sample. Maintaining body temperature helps preserve the specimen condition needed for accurate testing. Chilling or freezing would encourage the very reaction the test handling is designed to avoid. Question 33. What should a phlebotomist do if an inpatient's door is closed and a sign states "No visitors, see nurse" before entering? Option A, knock loudly, open the door, and walk right in to maintain efficiency. Option B, locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C, skip the patient and come back at the end of the shift without checking in. Option D, call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 34. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 35. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option of light blue top. Option B, lavender top. Option C, grey top. Option D, green top. The correct answer is option C, grey top. Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing grey tubes too early increases additive carryover risk. Question 36. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A, petechiae. Option B, hematoma. Option C, thrombus. Option D, hemostasis. The correct answer is option B, hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 37. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A, artery. Option B, capillary. Option C, vein. Option D, arteriole. The correct answer is option C, vein. Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 38. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option of leukocytosis. Option B, leucopenia. Option C, thrombocytopenia. Option D, polycythemia. The correct answer is option B, leukopenia. Leukopenia means an abnormally low white blood cell count. It may indicate myelosuppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass. Question 39. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A, sodium polyethylene sulfonate, SPS. Option B, acid citrate dextrose, ACD. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option B, acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 40. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A, the needle will slip and miss the vein entirely. Option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C, the patient's blood pressure will drop rapidly. Option D, the vacuum inside the collection tube will increase significantly. The correct answer is option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 41. What does the term lipemia describe? Option A, a high concentration of broken red blood cells giving serum a red tint. Option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C, a dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D, a clear, watery fluid component lacking any cellular proteins. The correct answer is option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 42. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option A 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B, 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 43. Which of the following errors is an example of a post-analytical error? Option A, failing to mix an EDTA tube, causing a microclot to form. Option B, mislabeling a patient's name at the bedside drawer. Option C, delayed reporting of critical panic values to the attending physician. Option D, leaving a tourniquet on a patient's arm for 3 minutes. The correct answer is option C, delayed reporting of critical panic values to the attending physician. Delayed reporting of a critical value occurs after analysis, so it is a post-analytical error. Timely communication of panic values is essential because treatment may depend on rapid notification. Collection, labeling, and tube mixing errors occur before analysis. Question 44. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A, allowing a serum separator tube to clot completely before centrifugation. Option B, balancing the centrifuge correctly with tubes of equal volume. Option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D, keeping a plasma specimen chilled on an ice slurry. The correct answer is option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 45. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 46. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A, clear or plain red glass top. Option B, light blue top. Option C, lavender top. Option D, light green top. The correct answer is option A, clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 47. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 48. What type of isolation protocol requires healthcare workers to wear a gown, gloves, and use dedicated equipment to prevent spreading resistant GI infections like C. difficile? Option A, airborne isolation. Option B, droplet isolation. Option C, contact isolation. Option D, protective reverse isolation. The correct answer is option C, contact isolation. Contact isolation is used for organisms spread by touch or contaminated equipment, including resistant gastrointestinal pathogens such as C. difficile. Gown, gloves, and dedicated equipment reduce environmental spread. Airborne and droplet precautions target respiratory transmission routes. Question 49. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A, activated partial thromboplastin time, APTT. Option B, prothrombin time / international normalized ratio, patient / INR. Option C, bleeding time determination. Option D, complete blood count, CBC. The correct answer is option B, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 50. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A, the veins are too large and prone to exploding. Option B, the lack of muscle movement leads to poor circulation and potential thrombosis. Option C, the patient cannot feel if a nerve is being struck by the needle. Option D, paralyzed limbs do not contain white blood cells. The correct answer is option B, the lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 51. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, axillary vein. The correct answer is option B, cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 52. For which of the following tests must the specimen be protected from light immediately after collection? Option A, ammonia. Option B, bilirubin. Option C, lactic acid. Option D, prothrombin. The correct answer is option B, bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 53. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A, voiding directly into the cup without any prior cleaning steps. Option B, cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C, saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D, restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B, cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 54. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A, assault. Option B, battery. Option C, invasion of privacy or breach of confidentiality. Option D, negligence. The correct answer is option C, invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 55. What color top tube contains the additive EDTA and is the primary tube used for a complete blood count? CBC. Option A, lavender top. Option B, light blue top. Option C, green top. Option D, gray top. The correct answer is option A, lavender top. Lavender tubes contain EDTA and are the primary tubes for CBC testing. EDTA prevents clotting while preserving blood cells for accurate counts. Serum or heparin tubes do not provide the standard specimen required for routine CBC analysis. Question 56. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A, plasma. Option B, serum. Option C, whole blood. Option D, fibrinogen-rich extract. The correct answer is option B, serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 57. What should a phlebotomist do if they accidentally puncture an artery during an attempted venipuncture? Option A, complete the draw quickly and label the tube as venous blood. Option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. Option C, leave the tourniquet tied tight to prevent a hematoma from forming. Option D, instruct the patient to bend their arm firmly over a gauze pad. The correct answer is option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. An arterial puncture during venipuncture requires immediate needle removal and firm direct pressure for an extended period. Nursing staff or the provider should be notified because arterial bleeding can form a significant hematoma. Continuing the draw or applying light pressure is unsafe. Question 58. When centrifuging specimens, what is the most important operational rule to follow? Option A. Centrifuging serum tubes immediately before they clot. Option B. Ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C. Leaving the lid open slightly to prevent overheating of the tubes. Option D. Setting the speed to the maximum RPM regardless of tube type. The correct answer is option B. Ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 59. What type of vessel links the smallest arterial pathways with the smallest venule pathways? Option A. Capillary. Option B. Sinusoid. Option C. Lymph duct. Option D. Deep artery. The correct answer is option A. Capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 60. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A. Prolonged tourniquet application past 2 minutes. Option B. Chilling the specimen on an ice slurry. Option C. Using a 21-gauge needle on a large vein. Option D. Failing to wipe away the first drop of blood during a finger stick. The correct answer is option A. Prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 61. What occurs during the pre-analytical phase of laboratory operations? Option A. Running standard controls on a chemistry profile machine. Option B. All processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. Option C. Interpreting a bone marrow biopsy under a microscope. Option D. Transmitting final electronic medical record entries to billing. The correct answer is option B. All processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. The pre-analytical phase includes everything that happens before actual testing, including orders, patient identification, collection, handling, and transport. Many laboratory errors occur in this phase because specimen quality is established before analysis begins. Analyzer operation and result reporting belong to later phases. Question 62. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 63. What clinical term describes a systemic infection caused by pathogenic microorganisms or their toxins circulating in the bloodstream? Option A. Hematoma. Option B. Sclerosis. Option C. Septicemia. Option D. Petechiae. The correct answer is option C. Septicemia. Septicemia is a systemic bloodstream infection caused by pathogenic microorganisms or their toxins. It is clinically serious because organisms and inflammatory mediators circulate throughout the body. Hematoma, sclerosis, and petechiae describe local bleeding or vessel conditions rather than systemic infection. Question 64. What is the primary function of erythrocytes, red blood cells, in the human body? Option A, defending the tissues against pathogenic bacterial invasions. Option B, participating in the primary aggregation phase of blood clotting. Option C, transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Option D, producing circulating antibody proteins in response to vaccinations. The correct answer is option C, transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Erythrocytes transport oxygen from the lungs to tissues and help return carbon dioxide to the lungs. Their hemoglobin content allows efficient gas binding and delivery. White cells defend against infection, and platelets support clot formation. Question 65. What is the target population for a Guthrie card or newborn screening test panel? Option A, geriatric outpatients in nursing homes. Option B, infants up to a few days or weeks old. Option C, pregnant women in their first trimester. Option D, patients undergoing active chemotherapy treatments. The correct answer is option B, infants up to a few days or weeks old. Guthrie cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 66. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option A, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 67. If a phlebotomist must use a syringe to collect blood, what device should be used to transfer the blood into vacuum tubes? Option A standard needle attached to the syringe puncturing the tube top directly. Option B, a syringe transfer device with a shrouded needle. Option C, pouring the blood from the syringe barrel after removing the stopper. Option D, injecting it through a butterfly needle set. The correct answer is option B, a syringe transfer device with a shrouded needle. A syringe transfer device allows blood to move safely from a syringe into vacuum tubes without exposing the needle. The device reduces needle stick risk and helps maintain tube vacuum and fill order. Removing stoppers, pouring blood, or puncturing stoppers with an exposed needle is unsafe. Question 68. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A, draw the specimen and cross out the number on the tube label. Option B, proceed with the draw as long as the alphabetical spelling of the name is correct. Option C, do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D, ask the patient which number is the correct one to use. The correct answer is option C, do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 69. What does the term phlebotomy literally mean in Greek? Option A, to clear a blood clot. Option B, to measure blood cells. Option C, to cut into a vein. Option D, to study circulating fluids. The correct answer is option C, to cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 70. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A, routine cholesterol screen. Option B, workplace drug testing. Option C, blood culture for endocarditis. Option D, complete blood count for anemia. The correct answer is option B, workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 71. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 72. What is the primary function of the circulatory system's capillaries? Option A, transporting blood under high pressure away from the ventricles. Option B, permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Option C, directing large units of blood directly into the vena cava pathways. Option D, preventing the backflow of lymph fluid into the deep tissues. The correct answer is option B, permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Capillaries are the exchange vessels of the circulatory system. Their thin walls permit transfer of oxygen, carbon dioxide, nutrients, and waste products between blood and tissues. Arteries and veins mainly transport blood to and from capillary beds. Question 73. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 74. Which of the following items is classified as a biohazard and must be disposed of in a rigid sharps container? Option A clean, unused plastic tube holder. Option B, a blood-soaked gauze pad. Option C, a used lancet device from a heel stick. Option D, the paper backing from an adhesive bandage. The correct answer is option C, a used lancet device from a heel stick. A used lancet is a contaminated sharp and must be placed in a rigid sharps container. Sharps disposal prevents puncture injury and blood-borne pathogen exposure. Gauze may be biohazardous if saturated, but it does not belong in a sharps container unless it contains a sharp. Question 75. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A, high levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 76. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A, hold the needle steady inside the vein to complete the draw. Option B, remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. Option C, place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D, restrain the patient's arms firmly against the drawer chair to stop all movement. The correct answer is option B, remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 77. What is the primary function of the anticoagulant EDTA? Option A. It enhances the action of thrombin. Option B. It binds calcium ions, preventing the clotting cascade from activating. Option C. It destroys white blood cells to preserve red cells. Option D. It stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B. It binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 78. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas (ABG) draw? Option A. 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B. Plain sterile water. Option C. Diluted hydrogen peroxide solution. Option D. Sodium hypochlorite spray. The correct answer is option A. 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 79. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A. Use the partial sample anyway and send it to the lab. Option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C. Pour blood from a green top tube into the light blue tube to top it off. Option D. Shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 80. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A. Gently advance or pull back the needle slightly to ensure it is in the lumen. Option B. Remove the needle completely and start over on the other arm. Option C. Leave the tube in place for 3 minutes to allow the vacuum to recover. Option D. Push the needle deeper at a 90-degree angle. The correct answer is option A. Gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 81. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A. The posterior curvature of the heel directly over the calcaneus bone. Option B. The medial or lateral margins of the plantar surface of the heel. Option C. The central arch area of the foot pad. Option D. The tips of the smaller toes. The correct answer is option B. The medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 82. What type of sample is collected during a therapeutic phlebotomy procedure? Option A. A tiny capillary tube for microhematocrit checking. Option B. A large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Option C. A series of 3 blood culture bottles over 24 hours. Option D. An arterial sample for gas analysis. The correct answer is option B. A large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Therapeutic phlebotomy removes a large volume of blood, often about 450 to 500 ml, to reduce red cell mass or iron burden. It may be used for conditions such as polycythemia vera or hemochromatosis under provider order. It is different from diagnostic venipuncture, which collects small specimen volumes. Question 83. Which of the following options describes the best method to prevent a vein from rolling during needle insertion? Option A. Tying the tourniquet directly over the intended puncture site. Option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Option C. Having the patient pump their fist continuously during needle insertion. Option D. Inserting the needle quickly at a sharp 90-degree angle. The correct answer is option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Anchoring pulls the skin taut below the puncture site to stabilize the vein. This prevents rolling and allows a controlled needle entry. Tying the tourniquet over the site, fist pumping, or using a steep angle can increase injury or specimen problems. Question 84. What condition can occur if blood is drawn from an arm on the same side as a recent radical mastectomy? Option A. Syncope. Option B. Lymphedema and altered test results. Option C. Petechiae. Option D. Sclerosed veins. The correct answer is option B. Lymphedema and altered test results. The arm on the side of a recent radical mastectomy may have impaired lymph drainage and increased risk for swelling. Blood collection there can worsen lymphedema and may also produce altered results from compromised circulation. The unaffected arm or an approved alternate site should be used whenever possible. Question 85. What does the term erythema mean? Option A. Redness of the skin caused by congestion or inflammation of the capillaries. Option B. A pale appearance of the skin due to low red cell counts. Option C. A bluish tint to the skin caused by a lack of oxygen. Option D. A yellowing of the skin caused by high bilirubin levels. The correct answer is option A. Redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 86. Which of the following can lead to a rejected specimen due to short draw? Option A. Inverting a lavender tube 8 times. Option B. Underfilling a light blue coagulation tube. Option C. Using a 21-gauge needle on a large vein. Option D. Drawing a serum separator tube before a green tube. The correct answer is option B. Underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 87. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A standard eye wash station. Option B. A safety drench shower. Option C. A fire blanket wrap. Option D. An isolation gown station. The correct answer is option B. A safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 88. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A. Lightmia. Option B. Icterus. Option C. Hemolysis. Option D. Hemoconcentration. The correct answer is option C. Hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lightmere appears milky, and icterus appears yellow to amber. Question 89. What is the minimum amount of time a serum separator tube, SST, must stand in a vertical rack to clot completely before centrifugation? Option A, 5 minutes. Option B, 10 minutes. Option C, 30 minutes. Option D, 90 minutes. The correct answer is option C, 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 90. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 91. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 92. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B, tighten the tourniquet further to stop the spots from spreading. Option C, ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D, rub the skin surface firmly to see if the spots disappear. The correct answer is option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 93. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A, 5 to 10 degrees. Option B, 10 to 15 degrees. Option C, 30 to 45 degrees. Option D, 60 to 90 degrees. The correct answer is option B, 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 94. Specimen tubes must be labeled at what point during the collection process? Option A, prior to entering the patient's room. Option B, immediately after drawing the blood, before leaving the patient's side. Option C, at the central processing lab desk. Option D, after the specimen has finished centrifuging. The correct answer is option B, immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 95. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 96. Which of the following additives is used to preserve glucose stability by preventing its breakdown by red blood cells? Option A. Sodium citrate. Option B. Sodium fluoride. Option C. Lithium heparin. Option D. Ammonium oxalate. The correct answer is option B. Sodium fluoride. Sodium fluoride preserves glucose by inhibiting glycolysis in blood cells. This slows cellular consumption of glucose after collection. Citrate, heparin, and oxalate alone do not provide the same glycolysis inhibition. Question 97. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A. Hematoma. Option B. Hemolysis. Option C. Petechiae. Option D. Ichthyosis. The correct answer is option C. Petechiae. Petechiae are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 98. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A. Pearl/white top with gel barrier. Option B. Light blue top. Option C. Gray top. Option D. Yellow top with SPS. The correct answer is option A. Pearl/white top with gel barrier. Pearl or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 99. Which of the following parameters can cause a false decrease in glycolysis tracking within a serum specimen? Option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Option B. Chilling the specimen on ice immediately after collection. Option C. Protecting the specimen from exposure to room lights. Option D. Mixing the tube gently 5 times right after the draw. The correct answer is option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Glucose decreases when unseparated blood remains at room temperature because cells continue glycolysis. Serum left in contact with red cells for more than 2 hours can therefore show falsely low glucose. Prompt separation or use of a glycolysis inhibitor helps preserve the result. Question 100. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A. Lithium heparin. Option B. Ethylenediamine tetracetic acid, EDTA. Option C. Sodium fluoride. Option D. Ammonium oxalate. The correct answer is option B. Ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation.